Good morning, ladies and gentlemen. This is the Public Affairs Roundtable. It's the show produced each month by the Williamson, Inc., our Chamber of Commerce here in Williamson County. And we are glad to have all of our folks in the audience this morning. Hope that you find this program informative and engaging. We've got a special guest this morning, our Congressman, Marsha Blackburn from Williamson County in the 7th District. And we're awfully glad to have you with us this morning, Congressman. Lots going on in Washington and around the country that affects us all and can be affected by the things you all do in Washington. And we're looking forward to hearing, what you're seeing in Washington and how that is playing out. You were elected in 2002, I think, so almost 15 years. Yeah. What's that like? I mean, did you anticipate a long-term deal?
Never, you never do. You go, you serve, you get busy working, you're pushing issues forward, and it's amazing how time flies. Absolutely amazing.
It flies faster all the time, and the older our children get, the faster it goes. So
yes, the younger we get.
Exactly, and. Now, the 7th Congressional District, I had to look it up to see where that actually covers, but help us understand who all you represent.
Absolutely. It is, and it's a wonderful district. 19 counties. We end up bordering Kentucky, Alabama, and Mississippi in this district. 19 counties, 10,000 square miles. So it is much of the area down toward Memphis as far as Hardeman County, Giles County in the southeast quadrant. Then you go up to Stewart and Benton, Houston, Montgomery County. Fort Campbell is in this district. As you all know, Fort Campbell primarily sits in Montgomery County. So that is the parameters of the districts. Landmass-wise, 10,000 square miles. One of the largest, landmass-wise, the largest congressional district. Numbers of counties, the largest congressional district. And population-wise, actually, one of the largest. One of the things that is so interesting is to people is that this also is one of the districts with the highest veterans population. And much of that is due to the service of the men and women at Fort Campbell who choose to come back and retire here. And then when you get down on the west end of our district into Hardeman County, you have many that have served with the Coast Guard and with the Navy that are in that area. So a big military presence.
Awesome. Now, the just totally lost my train of thought there, but we'll come back to that when I think of it. But before we get into the meat and potatoes this morning, let's talk politics a little bit, since that's the latest announcement that the media has latched onto. Senator Corker decided not to run again, and several places I have read you're the front runner.
Well, Chuck and I will visit with our children and do what we always do. We make family decisions. Will we look at it? Yes, absolutely we will. We'll determine where's the best place for us to continue to serve and to work. So the next few days we will give it a good look-see. And in our family, we do this thing called a family call. When there's a decision to be made, we go through that process of proper vetting, appropriate vetting, and discussion, and look at how it affects us, how it affects our family. Look at what they want to do, how they would choose to move forward. So, we'll give it proper consideration, and then once we've finished and the children have had their chance, and now grandchildren have their chance to weigh in, then we'll have something to say about it.
Well, your staff asked me not to ask that question, but Sorry.
That's perfectly fine. It is
The,
perfectly fine.
There's, you represent several committees in Congress. Tell us a little bit about those. I don't totally understand
Sure.
what they all do, but I know you spend a lot of time, particularly around internet legislation.
Absolutely. The committee that I serve on is the Energy and Commerce Committee. It is the committee that is required by the Constitution for Congress to have. It is the oldest standing committee in Congress, and I am so grateful for the opportunity to have a seat on that committee. I serve on the our issue areas. Of course, it is energy and issues that affect the environment. You also have commerce. And in that, we get into the manufacturing component. The auto manufacturing component is a big part of what we oversee. Small business manufacturing, trade comes under our jurisdiction. Then you get into healthcare, which is under our jurisdiction, and then the internet, communications, technology, and I serve as chairman of the subcommittee on communications and technology. And I will tell you, I just am so appreciative of the opportunity to have a seat on that committee. I work with our mayors, and of course, we're fortunate to have our mayors here. Rep. Whitson's here with our state electeds. We are forever working on issues that deal with the EPA, issues that deal with our small business and manufacturing sector. So it is a great way for me to be of service to our community. Of course, healthcare. When you look at hospital management and healthcare delivery, healthcare insurance with the Medicare Advantage programs that are housed here in our district, I'm appreciative of the opportunity that I am there and on that health subcommittee. And especially as we look at the nexus between healthcare informatics and healthcare delivery and the facilitation of better healthcare between these two committees, interoperability, data transfer, components of that nature. We look at what transpires in our committee with communications and technology and the subcommittee that I chair. The components that are on our agenda right now are looking at the FCC, Federal Communications Reauthorization. We are working through that. We do that in a bipartisan manner, and we are continuing to construct that bill to reauthorize that agency. The NTIA, we are in the process of working on reauthorization legislation for them. We are beginning our work on what will be the open internet rules that we will codify. And it's really, really interesting when you look at that. Everyone's against throttling, everyone's against blocking. And so we will move forward on those areas. And in this ping pong of every time you have a different head at the agency, the rules change. So we know that the private sector is ready for us to do that work in codifying that. Broadband and broadband expansion is going to be next on our plate. I'm in the process of writing that broadband expansion bill right now. We are going to handle this in a technology neutral manner. It doesn't matter if broadband gets to you by wireline or fiber or wireless or fixed wireless or satellite. What matters is that we get that broadband into these communities that do not have access to high-speed internet. And I know the mayor does a great deal of work with other county mayors and city mayors and economic development boards. And it is the #1 infrastructure issue that we have in this state. There is nothing else that even compares. but the desire to get high-speed internet. And of course, Sam and the guys in the state legislature dealt with it some last year, and they're going to be dealing with it again when they go back. And one of the things we're trying to do, and that I'm very mindful of because of having served in a state legislative body, is it will facilitate their work if we can get the federal government to say, this is what our bill is going to be. And I know y'all are waiting for us to take that action. The process that we're working through, we are looking at the 477 maps, as they are called. This is something that affects our mayors and our electeds and our economic development groups. And that goes through and says, this is where you have unserved areas that get no internet. This is where you have areas that are underserved. And then cleaning those maps up. Our state legislature did a good job on this last year and doing their maps. They're better than the FCC's maps. So we're going through that process of harmonizing those. We are also looking at what the speed should be, how we define high-speed internet. Should it be 15.3? Should it be 25.3? 25.5? And that is something that we will set in place, and then we will move forward with what the grant structure will be. We just finished and worked with our, did a lot of good work with our repacking, if you will, recouping spectrum. We've worked with the broadcasters on this and pulling back in some of that 600 megahertz band spectrum, and we're going to get that repacked and ready to go back out to auction, and then we'll have the opportunity for that money to go into the grant pool that our communities and counties will have the ability to access those funds. So that's taking a lot of our work. I talked to Daniela. I don't see where she is right now because I can't see. Okay, there's her hand. See it. We are doing some work on the privacy and the school privacy issue. I know that this is something that our school board has been interested in. We will get to that probably later in the fall or early first quarter next year. Yeah.
Great. Good. Mm-hmm. The somewhat related to all the internet talk, most of us, the internet, we use it, of course, in our businesses, but Amazon seems to be taking over the world. And as a business organization, we're concerned that some of the businesses that sell through Amazon do not charge sales tax.
Sure.
And that's a concern for our cities. It's a concern for the county. What is happening there? What's the prognosis, and what do you see?
Yeah, I don't see it coming up in the tax relief package. I don't think it's something that they are going to get to. I do think, and then when you have the state electeds, this will be a great question to put on the table, because through the current sales and use tax statute, there is a way for states to come in and facilitate that. At the federal level, I don't see it happening. Many times it gets linked to having a federal VAT tax. Mm-hmm. So I think that is going to be one that stays with the states for the states to decide. And I think that's something that, yeah, you might want to do that when the state guys come and talk about how they're going to change the distribution within the sales and use tax code. Right. Is that fair? Yeah.
Sam, we'll put that on the list for the first of the year. President Trump, of course, announced, I think day before yesterday, his tax overhaul proposal, which is got some remarkable things in it, and some things that we thought would be there aren't there. But for individuals, doubling the standard deduction and reducing the number of tax brackets, basically just a simplification there for individuals. Like to focus on what it does for corporations, though, and for businesses. Tell us, if you will, what your understanding is of what he wants and what the possibilities of that actually happening are.
Right, and I think if you were to boil it down to say what is important to the President and to Secretary Ross, who is the Secretary of Commerce, and to Gary Cohn and Steve Mnuchin. What they're looking at is economic growth that is going to be consistent, solid economic growth. How do you generate jobs and jobs growth? And get people to the point that not only are they going back to work, but you have wages increasing and seeing the opportunity for wage growth. Now, one of the things that I think is important in this bill is you talk about new start businesses and the entrepreneurial component that is there. And yes, that's important. But their focus is what I call your Main Street businesses, the small businesses that have kind of survived that initial hump. And they've grown and they've gotten through that initial period and they're ready to see growth. And these are the small businesses that line our streets and fill our communities, and they are looking for the opportunity to have some tax relief. And that is why in this bill you see the application of the business tax going to the pass-through entities. And you take somebody like Larry, who has helped grow dozens and dozens of small businesses here. And they can tell you chapter and verse how lowering that applicable business rate on that pass-through entity income, whether it's an LLC or a partnership or a sub-S, and lowering that rate for those small business owners gives them the opportunity to turn around and put that money back into that business so that they are expanding that business. They are growing that business. They are hiring employees. And see, as you know, Dave, when you are putting that focus there on businesses that are ready to grow, ready to expand, it is going to make it easier. Now, couple that with the fact that these entities are filing an individual return, and you flatten out those rates, and you go to 12 and 25 and 35. And then what you've done is to reduce that entire tax load that is on those individuals, and free up that income. In addition to that, for wage earners, they will be able to go in and reset their withholding, because as you look at, you've maybe moved down, your bracket itself is flattened out, but you've moved down a bracket because you bring those floors up. Then what you've got is everyone can go reset that withholding. And this tax bill, when we pass it, will be retroactive to January 2017.
Okay.
So that is going to facilitate individuals getting a refund, a larger refund. So we are very pleased with where that is, and we think the discussion on it has been very healthy. Chairman Brady and the President both have been very clear that they're looking for bipartisan and hopeful, very hopeful for bipartisan support on the bill.
One of the reading I've done, one of the most stimulative things you can do for the economy is to do away with depreciation of capital investments. In other words, if you make a capital investment this year, you can expense it this year. Is that, am I understanding that correctly? Is that
yes?
Is stimulus
exactly. It is, and it would be a private sector stimulus, if you will. But being able to expense your capital improvements. Here is how, coming around to that. Let me ask you this. How many of you find yourselves buying new technology every single year?
All of us.
Yeah,
Yeah.
exactly. That's exactly right. And the life cycle on this technology is very different than many of the other pieces that you would have bought in a traditional industrial sector. And what you want to be able to do is move that, what we found ourselves repeatedly doing. I see a couple of you shaking your hands. You get this, you know, trying to move that schedule forward so that you are through depreciating that before it is obsolete.
Right.
And so with the utilization of technology, moving to expensing is important. I tell you another place that it is important and an important change, and I'd love to hear from some of the CPAs on this, is cost of goods sold and being able to change the way that is handled on the tax schedule. So I fully think that having these conversations is a very healthy thing for us to do.
One of the things that just didn't show up in this bill that Chairman Brady and Speaker Ryan had pushed pretty hard was the border adjustment. What happened?
It was not a popular tax, and I have spent many, many hours meeting with some of our businesses that are headquartered here and with some of our manufacturers that are headquartered here, and have, you know, sat down with them at the desk and looked at the figures of exactly how that border adjustment tax would affect them, whether it was manufacturing, whether it was retail sales, and look at what the harm would do to the cost of products they were manufacturing or the cost of products that they were selling. And we know that that tax was something that was going to end up being passed on to the consumer. And I think not only did Speaker Ryan and Chairman Brady hear from me, they heard from a lot of people that had constituents that were like mine who would just say, this is where this would be unworkable for us. So that is why you don't see the border adjustment tax as a part of that.
Right. Our elected officials here locally are concerned about the deductibility, or maybe misspeaking here, but the use of tax-free bonds for
Municipal
state
bonds,
and
right.
Local projects. Are they going away, or what's happening there?
No, and this is a conversation that we'll probably all want to have as we get more details and then as we begin to work through the fine-tuning. We know that that's an important component, and it's something that we should have a discussion on.
Correct.
Yeah.
Another development this week is that the Republicans tried and were unable to get another, I guess you would call it an Obamacare repeal bill through this one, the Graham Cassidy bill. Why is this so hard to get a bill through?
I think that it is hard because you're trying to get people to agree on how you should go about the process of reforming not only the health insurance marketplace, but the delivery of health care, and then subsequent to that, the reimbursement of health care. And we passed our bill out of the House. It went to the Senate. We thought the Senate would take it up in May. The Senate did not take it up in May. They decided to take it up in September, and then they have someone's in the hospital who was going to be a yes vote, and they couldn't get it done before the September 30th deadline, which is the deadline for the reconciliation component of the budget, the 2017 budget. The fiscal year for the federal government begins on October 1. So that is why they were trying to fit it in under the wire. Now, I will tell you there were some things in that bill. The governor and I had talked last week as we were working through some of this, and the senators and I had talked to also. The block granting of Medicaid back to the states, that is something that many of our governors, ours included here in Tennessee, they liked that. and they like the idea of having that come back because there is the ability for the state to decide how they're going to deliver those services, and they get the money and the authority to do it. So that was very warmly received, I will say, and by our governors in a bipartisan basis. And it's a good way to approach this. I think that most everybody here would say the General Assembly would do a better job of making those determinations than the federal government.
Right.
I do know that some of the other provisions that need to be addressed in this that came in the House bill, we're still working to push forward. The patient and prevention grants, the state innovation grants, those are components that would be very well received by the hospitals that are in our state, because it gives them the way to get inside that Medicaid delivery and innovate how they are going to deliver service to their patients. And I'll give you a great example of that. There is one hospital in our district that has decided to change how they're doing emergency room delivery. And what they have done is to co-locate an emergency room and an urgent care center. And people are directed into the urgent care center for triage. And if it is something minor, they can handle it there. If it is something that they need to go to the emergency room, they can do that. They also have built a behavioral health wing so that they can work with patients with PTSD, with drug abuse. Mm-hmm. So basically, they've got 3 pods in this emergency room. That's the kind of innovation that is beginning to take place because our healthcare providers want to do their best delivering a good product for the people that are in their communities and that they serve. So, pardon me, they are, we want to encourage that kind of innovation. You know, that is something, it speeds up the process if it is something minor. And a mom with their children with something that is minor, they're out and on their way home. And in addition to that, the cost is less to the system. If it is something that requires emergency treatment, they are into the treatment sooner.
Right.
And that speeds that process.
Backing up to the bill itself just a minute, is John McCain ever going to vote for an Obamacare repeal bill?
I have not talked to Senator McCain. I don't know if he is going to vote for something. I will say this. The Affordable Care Act health insurance marketplace is imploding, and we are very concerned about that and the effect that it is going to have on the 10.4 million Americans who are in that marketplace and on the system as a whole. One of the things, I wanted to go back and look at the cost of insurance. So I worked with HHS on looking at the cost of insurance pre-Affordable Care Act and then what has happened to it in our state. Mm-hmm. And health insurance costs in this state have gone up 176% since that went on the books.
I can vouch for that.
Yeah, and in last week, as we were out and about in our district and holding meetings and talking with people, what we heard regularly, and some of you in this room have talked to us about this, you want to be able to offer an insurance product to your employees, and the cost of offering that has become so great that you're not able to offer the type product that you used to offer or offer it as a complete paid benefit. Mm-hmm. And people have had to go in and restructure it. I will say also, the number one complaint we hear about the exchange plans is that once you get one, they are generally too expensive to use.
Right.
And when we look at the concerns that come into our office and the constituent calls and conversations we have, generally, it's about the out-of-pocket costs that are required to use these plans. And if your deductible, if you're a family of four and your deductible is running somewhere between $8,000 and $20,000, you know, that's not insurance. That is something that is there in case of catastrophe, or it would be like the old major medical plans. But it is not something that you utilize in your healthcare, daily healthcare.
Right. Now, some of my Republican friends will question my loyalty here, but I'm going to ask a question. As a small businessman, my health insurance for my family went up drastically after Obamacare was instituted. And this may be a misperception, but this is the way I see it, okay? The big corporations' health care plans didn't change. The government health care plans didn't change. But the uninsurable people are now being paid for by those of us who have a small business, who have an individual policy. That's where we got lumped in with the quote-unquote uninsurables. Now, Bernie Sanders has proposed a single-payer, basically, it sounds like a Medicaid expansion, where everybody is just
Right.
Swept into Medicaid. What's wrong with that?
I think that what is wrong with that is the fact that it, pardon me, it becomes a federal program. And you don't have examples of where you have a government-run program where it has lowered the cost and has yielded better outcomes. And you look at what has happened under the Affordable Care Act with the cost going up. You look at the cost of delivery of Medicare. Medicaid. Why do our governors want us to send Medicaid back to the states? Because they can deliver a better product that will, working with their delivery systems via Medicaid, and they can do it at a more affordable cost that is going to be fair to the taxpayers.
Right.
So that is why they have said, you let us do this and get the federal government out of it. And I think that escalation of cost of health care, what we would love to see is more patient-centered health care as you move to personalized medicine, which is definitely the trend. What you would like to do is be able to see there be more patient intervention into this. One thing I will say, the bill, H.R. 314, my legislation that is the cross-state line purchase of health insurance, something that I've worked on since 2008, and opening up the health insurance marketplace. So you can buy whatever you want from whomever you want, wherever they are. That is something we've continued to work through with our departments of insurance, with our state legislators, and we are very hopeful that in the coming months we're going to see that move. There's a tremendous amount of conversation about it, around it. There is some talk that the president may, even by executive order, allow those state barriers to come down so that people can move across state lines. We're just pleased to see the conversation around the fact that this is an option that has bipartisan support and would help solve part of that problem.
Something pretty close to home. Sheriff Long, if you would step up to the podium. The opioid crisis, we keep hearing it doesn't just reside out in the country. It's right here amongst us. And Sheriff, give us a little flavor of how that's affecting Williamson County right now.
Yeah.
Well, it's affecting the entire nation. As you see reported in the media, the opioid crisis is at probably the top that it's ever been. Based off of that, the opioids is leading to heroin addiction, heroin overdose, carfentanil being mixed with the heroin, causing overdose deaths, the highest we've ever had. Methamphetamine was our top drug at one time. That has been replaced by the opioids, the pills, and East Tennessee, I think, faced it before Middle did. They were seeing the doctor shopping out of Florida, bringing the pills back and selling them in East Tennessee. It's now hitting all over the country. But the opioid crisis is number one in law enforcement right now as far as the addiction and the overdose deaths.
Yeah.
What can Congress do?
Well, and I appreciate the sheriff's comments, and we hear this from law enforcement officer after law enforcement officer. And one of the reasons, let me circle back to what the emergency rooms, one of the reasons some of our hospitals are looking at doing these behavioral health pods is because of the opioid issue and the fact that many times these individuals end up in our law enforcement and, system, and it becomes your problem instead of a medical and a treatment issue. So we are very mindful of that. What we have done, there was legislation that President Obama signed right at the end of the year, the 21st Century Cures Act. And we had a mental health bill and an opioid bill that, with Senator Alexander's help, once the bill left the House, all that legislation left the House, we folded those two bills plus my software act on healthcare informatics into the 21st Century Cures. And President Obama signed that at the end of the year. Now, what this does is put some grant money in the pool so that our local law enforcement will be able to pull these HHS grants. And it is specific to that issue. Now, the patient and prevention grants that I mentioned that we had in the AHCA that the House passed, the reason we want to do these grants is so that we can specifically target patients that are in groups of patients that have an opioid addiction and put that money on that specific problem. And that is why those grants and allowing the targeting of those grants is so vitally important, because this is a crisis issue. Opioid-related death is the #1 cause of death in men. And Sheriff, I know you know the stat. Is it 35 to 50?
35 to 50.
35 to 50, the leading cause of death. And this is something that we ought not to tolerate and ought not to say it's acceptable. It is something that demands a response. Think about that. Men, age 35 to 50, that is the leading cause of death. So, and we appreciate the work. I really appreciate the cooperation that you and the sheriffs and the others have given to us as you've come to D.C. and we've worked on this. We do have another piece of legislation that is moving that is kind of a deeper dive that will target some more money specifically into some of the areas that you all need, as well as some prevention, some education, and some of the pharmaceuticals that are being directed that can be the inhibitors that are there.
Good.
And let me say this, I know the first responders, I don't think we've got any of the first responders in the room this morning, but to have the packets, and you're shaking your head. Narcan, thank you. To have that to beef up funds so that they have more, a ready supply for their utilization in those first response instances.
Very important we do that, and the funding for that, we have stocked our deputies now, are beginning to stock them. We're doing the training for it now, but as you know, it's very expensive to buy that.
Very.
A lot of the agencies are not as fortunate as we are in Williamson County and cannot afford it.
And
I think
while you're at the mic,
great.
you might want to say, I think people would be interested in this. When you use the Narcan, How many doses does it generally take to stabilize somebody before they get them into the hospital?
Normally it takes one. It's a
One.
nasal administered. It takes one dose, and if one doesn't, you try the second.
It's amazing. But it's a great way to save lives. and we
Serious
appreciate that.
problem, Sheriff. We
Thank you.
appreciate your
Yeah.
color on that. And we've got so many other things that people are interested in. And you see Griffin circulating around, taking up cards with your questions on them. Just keep submitting them. I'm trying to get through some of these subjects ahead of you. But let's touch briefly on the DACA, the Dreamers. And let's do this really briefly if we can. But
Sure.
what should happen to the children who are brought here illegally and grow up in the United States? Could be probably pretty productive Social Security payers for us old guys.
Right, and I think what everyone says, let's be fair in that process. What is going to be the outcome? I don't know. I am so pleased that the president sent it back to Congress. It should be addressed by Congress. I do think President Obama knew, he actually said, he didn't have the authority to do that authority rested with Congress. And so it should come back to us. I don't know what the resolution is. There is a lot of conversation. There was a bill filed in the Senate this week that would address the children that were brought here. It does put some stipulations around chain migration. It also gets coupled with securing the border.
Right.
The combination of things that will be technology, wall.
Right.
The components that the Border Patrol have said, this is what we need. And that's where they ought to be. The Border Patrol has been very forthright in saying there are certain things that they need, so.
We could spend an entire program just on immigration and
Yes, we
the
could.
wall and that's
Yeah, and
those sorts of things. But
in addition to that, one of the things that the House Judiciary Committee is working on right now is looking at the visa entry and exit program. 40% of the individuals in the country illegally are here because they've overstayed a visa. And they are working through that issue right now.
Great.
Yeah.
Okay. Had a lot of shootings in this country and around the world over the last couple, 3 years. The latest one right here in Middle Tennessee, right
Yeah,
across the county
heartbreaking.
line. Terrible for the families involved, and we're all, I think, just living with them through this experience. But Representative Scalise
Yeah,
came back to
came
the
back
Congress
yesterday.
yesterday for the first time after the shooting in Washington. Any thoughts about what we can do about these shootings? What should be done about the guns? I know there's a bill out there regarding doing away with the requirement to not have a silencer on a gun. What's your position on those issues?
Well, one of the things that has come up regularly, and the sheriff and some of his colleagues have certainly been a part of this conversation, is looking at the intersection of mental health and the shootings. And Dr. Tim Murphy is who chairs those efforts, the mental health efforts, for us in Congress. And that is a component that definitely is under review. You know, when it comes to how law enforcement, how we're going to move forward with that, I can't tell you what the resolution is going to be. There are a couple of members who are working with law enforcement. Dave Reichert, who was a sheriff out of Washington State, has pretty much been the liaison with the law enforcement community, and they continue to have productive conversations. And Sheriff Reichert is going to retire from Congress at the end of 2018, and we do anticipate having something prior to that time.
Good, good. Lots of questions this morning about the NFL and whether the players kneel or stand. You filed a resolution this week on that issue. What What's your feelings?
I'm one of those, I think that there is a decorum and an etiquette for how we stand and how we conduct ourselves during the national anthem. And I think that you should stand when the national anthem is played. And if you want to protest later, First Amendment certainly allows that. Peaceful protest is encouraged, but not during the national anthem as a time of protest. So my preference is to see 36 U.S. Code 301, which is what defines how you conduct yourself during the playing of the national anthem, and that would be my preference, to see that honored and to see the respect shown for what the national anthem stands for.
Right. Good. No, sir. No, sir. No, sir. We are here to hear the Congressman's views this morning. Thank you. The Sheriff Long.
We won't have a town hall for us to ask questions, so we would like to be able to ask questions.
Sheriff Long, if you would ask them to really. Hurricanes are a huge problem for all of us these days.
Yeah.
And we've seen, what happened in Houston, what happened in Florida, and now what has happened down in Puerto Rico. There are some bills for relief that are going to help that issue. Is there anything else that we can do?
Well, my hope is that we're going to be able to, as a community, find the way to help. The Jones Act has been waived, and we passed legislation yesterday to speed some more money and supplies and things into Puerto Rico, which is just a tragic, tragic situation. Houston, I know, is also suffering tremendously, getting the Port of Houston dredged and the silt out of there so that they can get ships and tankers back in, so that they can begin to move tankers out with oil. That is a top priority for them in getting Houston stood back up. I know there's an enormous effort going into that at this point. My hope is, and this is something some of us have encouraged, and actually Vice President Pence, when he was a member of the House, started this effort, is having Congress set aside money in the budget as a rainy day fund or a disaster fund, so that if something happens, you've got that money there, because unexpected things are always going to happen. And we feel that would be a component of good and wise stewardship. And the state rainy day fund, as an example, and of course our state has to have a balanced budget, which is a good thing. And then they set aside money in the rainy day fund, and y'all hit $1 billion this year, right?
Right. We added up to 8% of our state budget, which keeps our AAA monitoring.
See, 8% of the state budget. That is the type thing that is a wise move for the federal government beginning to do, so that we do not have to do emergency appropriations bills and people do not have to wait, which is the most important thing, is that period of having to wait for aid to get to them.
Right.
So we're hopeful we can see that take place.
Right. My apologies to the audience. If you thought you were going to be able to express opinions and so forth this morning, we do want to hear what Congressman Blackburn has to say about things, and we do want to spend as much time as we have left getting through some of these other issues that are so important. But if we turn it loose with comments from the audience, it would never end. And we want to talk about 2 or 3 more things,
Sure.
Congressman. The infrastructure that we have in this country is
Yes.
certainly, everybody agrees, is inadequate. And TDOT Commissioner Schroer has lamented the indecision on the highway bills and things like that. I think we now have something that he can count on for the next couple of years. But so much more needs to be done. Is there any hope that we're going to see any more relief from the federal government on highways and infrastructure?
You know, I think that everyone has been frustrated with the Senate, and it's fair to say we're frustrated with the Senate because we pass bills out of the House, we send them to the Senate, and then they sit there. We've got 270 unaddressed bills in the Senate. The issue of infrastructure is no different. As I mentioned earlier, broadband is the #1 infrastructure issue, and we are fully aware of that. With the highways and transportation, of course, that is something that we do have that short-term or kind of a midterm bill that is in place. We hope to get to the broad-based infrastructure package very soon. You're going to have your all of your different portals will be there, whether it is going to be rail or air, the highway system. So yes, my hope is that the Senate will move forward with us and take that up.
Okay. And some of these questions are coming from our audience, and just to be fair, I will ask some of them, even though I'm not sure there's a good way to answer some of them. But town hall meetings have begun to be difficult for you and your colleagues in Washington. And I know some people would like to have town hall meetings so they can voice opinions, but what do you think? How should people voice their opinions back to you? Should it be in a town hall meeting? Should it be through the mail? What's the best? What's the best way to do this?
Keeping in contact is something that is vitally important, and we do dozens of meetings across our district on a regular basis. Dozens last week, certainly. Today, we enjoy having the opportunity to work with our civic organizations and churches and communities and chambers and hold those. In addition, we regularly do telephone town halls. Individuals like those, we're able to do them in the evening. They can just dial in from right there at home and express their opinion. Those all go for an hour.
Mm-hmm. When do you hold those?
We do them just periodically.
Okay.
When the budget allows and the time slot allows for us to get in that queue.
Okay.
And do one. We, in addition, do in-office meetings, and we encourage individuals to come and to meet with us. The office is here in the courthouse in Franklin. We've got an office up in Clarksville also, so our door is always open there. Every Friday, I do a newsletter, and that goes out usually about 4 o'clock on a Friday afternoon. Many times emails, emails that come in, responses that come in on that newsletter, I'll spend time every weekend responding to those emails, responding directly to constituents who have questions and making certain that they get to the right member of our team. Steve Albrooks is here. He's in our Franklin office. Christine Alexander is here with us today. I think Darcy Anderson might have scooted out. So we encourage people to see us as we're out and about, call us at a meeting, find us at one of the meetings that we're doing in the communities.
Okay. Lots of vehicles and venues.
Lots of vehicles in different ways because people want to engage in different ways.
Right. Sir, I've got to ask this one question. Ma'am, you had a town hall in Cherokee where most people showed up. We're going to be interrupted here a little bit for a moment, but the
You owe people 81% were constituents. That was qualified. That was definitely.
Gentlemen, we would appreciate it if you would take your seats. And if not, we would like you to leave, please. That doesn't matter. Everybody else is behaving themselves and sitting and listening. And that's what this is for. This is not the venue for that, sir. Thank you. Lots of, the president, interestingly enough, tweets a lot, Congressman. Some people think it would be better if he would go through the normal channels that presidents in the past have communicated with. What's your opinion? How do you see his change of decorum? Is that correct to say?
Yes, I would like to see the president use his tweeting to talk about the good constructive things that are being done, both by the House, the Senate, and by communities across this country. Where jobs are coming back, you are seeing healthy economies, you are seeing building taking place. So I would prefer that all of our energies focus on those.
I understand. Our time is up. We certainly appreciate you taking the time to
I'm
be with us.
delighted to be here and hope that people will continue to reach out.
I want to not only thank the Congressman, but for all the other people that make this program possible.
Absolutely.
To the Channel 3, Creed Henderson, and the Channel 3 crew that provide the venue and do all the work to put us on the air. For WAKM and Tom Lawrence for making sure it's broadcast on WAKM simultaneously. For Mayor Anderson and his staff for providing the place for this. And for Vanderbilt, we appreciate the financial backing to cover the bills and make it possible. We appreciate so much all of you being here. Our next program will be on the last Friday in October, and our guest will be Dr. Shauna Anderson from Columbia State Community College, and several of her colleagues there will be giving us an update on all the good things that have been going on there over the past couple of years. So we hope you'll come back. Look forward to having you again on the last Friday in October. Thank you very much.